Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita Valens, you look beautiful today. Are you living it up?
I'm living it up. Are you?
I am living it up, too. It's an amazing day, like it always is. But I like to let people know that it's amazing because a lot of people don't think so. I don't know why.
Well,
but,
maybe they're in pain. And we're going to help out with that today. How are we going to do that?
Well, I'm actually showing the camera right now my book called Stem Cell and Platelet Therapy. It's called, the byline is Regenerate, Don't Operate. And it's got the intro by Suzanne Summers. And what it says right in the front of the book is PRP, that's platelet-rich plasma, and stem cell therapy might just be what you're looking for. This book could change your life for the better. And she has a whole introduction here in the book. I'm going to send you this book right now for free. It's a $25 book. It talks about why surgeries are outdated, why they shouldn't be done. This is for orthopedics, by the way, for your musculoskeletal pain, anything from the head down to the feet and everything in between, and how surgery just isn't really a great thing, and how PRP and stem cells can help you heal. And it's worked on my body for the last 25 years that I've been doing this. And I know, Nita, it's worked on your body.
Yes, it has.
And I'm going to give out the phone number right now so you can talk to me live. So
Perfect.
Get a pencil and paper. If you're driving, try to pull off to the side, get off your Bluetooth if you want to call in. We would love to hear from you. Nita and I, although we've been together, how many years, Nita?
14.
Oh, my God. No wonder. We've been on the show 14 years. I've been doing it, I think, 21 years. We had Dr. Jean
25, I think.
Well, sometimes your thinking isn't always right, but I'm going to test you soon to find out.
Okay. Well, I just think that you undercut yourself sometimes.
I think I need to give out my phone number here.
Yes.
So the phone number is 866-870-5752. That's the phone number to talk to us live right now. Ask me questions about your musculoskeletal pain, about stem cells, about platelet therapy, PRP. And again, the phone number, jot this down, is 866 to the studio, 866-870-5752. And if you want to catch people at the office, they're at the office now on the phones. You can ask questions there also if we miss something on the radio. And that number to the office is 800-300-9300. There's also an amazing website, easy to remember, www.jointrehab.com. Jointrehab.com. Every page there will have a spot where you can email me personally. I answer every email every day from early in the morning to late at night, in between patients. Whatever it's doing, whatever is going on, I answer your emails. But why not just talk to me right now? Call me, 866-870-5752. If we don't get some calls in right away, guess what happens to poor Nita?
Oh, God, here come the bad jokes.
Well, some people like them. So,
I'm just kidding. No, it's fun when we do it. It is fun.
So some of my friends at this point, patients, send me jokes to talk about, which I'm going to do right now, because they love to see Nita up on the cross.
Yeah, they do.
So,
and it's not bad up there. It's fine.
So this is to Vic, Maria, and Roxanne who sent these.
Okay.
So why did the basketball hog not go to college? They knew he wouldn't pass.
Oh.
Nita, do you understand that even?
Yes, I do. I do, because
Right,
basketball players pass the ball. Yeah, I get it.
Yeah.
Yeah, I get it.
So here's another one, Nita. Basketball. You ready? Put on your basketball hat.
Yes, I got it.
What type of cheese do basketball players love?
Holy cheese.
Swiss cheese.
Ah,
Get it?
yes.
One more. Ready, Nita?
Okay. Is it still basketball?
Yep, this one's basketball.
Okay.
Basketball for 10.
Okay.
Where is a basketball player's favorite place to eat? Dunkin' Donuts.
Love that. That's a really good one.
Now, this is one for the general public. Okay, you ready?
Okay.
What do you get when you cross Darth Vader with Ella Fitzgerald? Even Nita can figure this one out. Just play with the words. What do you get when you cross Darth Vader with Ella Fitzgerald?
Ella, Darth
Oh,
Ella.
you're so close.
Darthella. Wait, no, Darthella.
An elevator.
Oh.
But you knew that, right, Nita?
Oh, yeah, sure.
I'm going to give out the phone number once more so you can save Nita from her high embarrassment with
Yes.
that huge intelligence.
Total
of hers.
humiliation.
So the number to call me right now and talk to me live is 866-870-5752. Also, not only do we do platelets and stem cells on the physical body to get rid of musculoskeletal pain, regrow the tissue instead of cutting it out, but we use it on the head. On the head, yeah, it stimulates the follicles to regrow hair if your hair is thinning. And it can be done on the face to thicken up the collagen on the face and to make you look young again. And that's called the vampire facelift, which is very cool. I love seeing people walk out looking better. So I'm going to go to some questions right now. Nita, is that okay with you?
Yeah, let's do it.
Let's do some questions. By the way, I get email questions all day, all night long, and I respond to all of them. You can go to the website, www.jointrehab.com, jointrehab.com, and send me a question right now if you're too shy to talk. I hope you're not, because we love our callers. So here is a question. Osteoarthritis in hands and neck. Let's see what the person says. I have x-rays that show osteoarthritis in my hands and neck. I'm looking for something to help me. Good. I do both of these all day, every day. We have osteoarthritis patients. We can have that anywhere in the body. Anywhere there's a joint, you can have arthritis. Osteoarthritis is very, very common. As people age, they seem to pick that up from overuse, from trauma, from too many sports. And it's something that we can help using your platelets and or your stem cells. And I would love if this person came into the office. You know who you are. Actually, this name is very famous. I'm not going to say who it is. It's a very famous radio personality. And yes, I just treated, very nice. There's a woman who came in yesterday after a 2-week hiatus. I injected her 2 weeks ago. And she had arthritis in her fingers, and her hands were sort of disformed like her grandmother's. And it's something that usually goes from in the female line when you see women that have these big nodes on their fingers. Often their moms or their grandmoms have that also, genetic thing. And I injected her fingers and all the joints. 2 weeks ago she came in, she was about 40% better. We re-injected again yesterday. I have many people. I don't get that many with hands. I mean, I do get a ton of them when I say that many. The most popular thing, believe it or not, are knees. Osteoarthritis in the knees or meniscal tears or labral tears in the hips, things like that. But I do get lots of necks also. And often I had a guy yesterday that came in and he had neck pain that was radiating down his arm. Now, he thought that he had a pinched nerve, but if you talk to an acupuncturist, they will tell you that's just a meridian. It's a referral pattern, and I get this all the time too. When we treat the neck or the low back, very often that sciatica or the radiculopathy down an arm can also go away. So once more, talk to me live, or I can take another question. And the phone number to talk to me live right now, don't be shy. You can use a fake name or say it's your father, or you can say it's your sister or something like that. The phone number to talk to me live right now is 866-870-5752. If you call now, I'm going to send you a free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with the foreword by the lovely Suzanne Summers, who's a great advocate of my work. She actually wrote a new book recently that has an entire chapter on stem cells and platelets. And Nita, have you read that book?
Yes, I have.
Yeah, I think the chapter she wrote I think it's a good 15 pages about
It's
regenerative
actually
medicine.
page 302 to 316, so it's actually good 14, 15 pages long that she did on you.
And I've
Fabulous.
had the good luck of working on her and on her son and on her grandchildren, all with very, very good results. So Suzanne Summers, we do love you, and we love that you're an advocate for things that are natural, which this is. And I am not an advocate of surgery. In my training, I did quite a bit of orthopedic surgery, and then I had a shoulder surgery that went bad on me, and it pretty much ruined my shoulder the surgery did for about 4 years, where I couldn't do much in the way of sports. And then I injected my own self with regenerative medicine one night, woke up the next morning completely full range of motion and no pain. It doesn't always work like that, folks. There's a lot of times where it can take several treatments. But I can't tell you in advance. Sometimes people that seem to have something that's minor will end up with it taking a while to heal. There's a lot of failure rates with regenerative medicine. You should know about that. It's typically because people have too much activity after their treatment. They can't give up their sport or whatever it is. So they keep beating up the area, and they don't give the cells a chance to heal and regrow. Another reason could be taking anti-inflammatory medicine like ibuprofen, which blocks the inflammation that helps fibroblasts come to the area, which are cells that grow collagen. And then there's something that I call a bad doc. It means that you go to somebody who doesn't know what they're doing. They went to a weekend course. It's not somebody who does this all day long like I do. This is something I've been doing for over 25 years, all day, every day. And then we get people that don't use ultrasound. Ultrasound it's like a camera. You can look inside the body and see where that needle is supposed to go. And if your doctor's not using an ultrasound, there is a very high probability they're not putting the solution anywhere near the pain generator that needs to be healed. So Nita, I'm going to go to Bill right now in Pasadena. Bill, I understand you've got an elbow issue. Tell me about it. How long has it bothered you for?
It's been bothering me about 5 months.
Okay. And what caused it?
Sir?
What caused the problem in your elbow?
I was doing some drilling in the cabinet that's above the counter in the kitchen.
Okay.
And I was doing 3 blocks, and I was holding the drill, and I had my arm inside the cabinet. Mm-hmm. And after that, my elbow started to hurt.
Does it still hurt the same way, or is it healing?
Well, it still hurts the same way. I went to a chiropractor and mentioned just put cold compacts on it for 4 times a day. And then I went to my other doctor, and he just gave me some pills for... anti-inflammatories? Right.
Okay.
And so it still hurts, maybe not as much, but it only hurts when I do a certain position. Okay,
that's very common, right? So you could have either lateral or medial epicondylitis. The lateral is called tennis elbow, the medial is called golfer's elbow, but you can get it from drilling your cabinets. I got it from weightlifting many years ago and from hitting the ground with a golf club. And mine haven't hurt me in a good 15 or 20 years. because I injected them with regenerative medicine, and they're completely healed. It's something I treat all the time with very, very good success using regenerative medicine. And very often it could be one treatment or two treatments to do that. If you want to come into the office, the phone number is 800-300-9300, 800-300-9300. I'd love to see you. And before I can tell you anything for sure, I need to touch the area, do an examination. I can't give you a very complete examination on the radio, right? From what you're telling me,
correct.
Yeah, from what you're telling me, I think I can help you, but I need to touch the area. I have people from all over the world that send me their x-rays or MRIs, and I call them up and I go, I can't tell you if I can help you based on an image. MRIs or x-rays don't tell me much. And I know that's the standard of care. It's the standard of care in medicine, but it's not my standard of care. My standard of care is touching and examining and moving your body around. The first one of these that I had was, my God, it's got to be 25 years ago. He was a music lawyer, and he played guitar quite a bit. And he was actually one of the most famous music lawyers in L.A. And he came in with lateral epicondylitis, and he went to a surgeon who did an MRI. They showed a tear in the extensor tendon, and the surgeon said he had to operate. And when he came to me, I said, I wouldn't operate on that. That's a crazy way to heal something, and it probably wouldn't work. So we did regenerative medicine on his elbow. It healed right up, and he was able to get back to playing guitar and hasn't had any problems since. And he's probably listening to the show. He refers me a ton of people, and that's what usually happens. A lot of people don't believe in things like this. You know, they're traditional. They want to get a surgery. And then they do come to me. A patient of mine who's been healed will send them here, and they heal. And then all of a sudden they become my greatest referral source. So we're going to send you a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, Bill. And you can actually read about how this works, the science of it. And if you go to my website, www.jointrehab.com, you'll actually see videos of me injecting elbows and seeing how that works. I think the video I have on there was a very high-level tennis player, and we healed him up. So it's an easy thing to fix, okay? So 5 months is way too long to be living with something like that as far as I'm concerned.
Yes. The doctor that, and I have this tablet here, he gave me for 7 days prednisone.
Oh, it's a prednisone. Don't take that.
Ah, okay.
No, do not take that. That's, to me, dangerous. When you take prednisone in high dose for a period of time, there's a probability, it's not a high one, but it happens. And I have a doctor friend of mine this happened to. She had pain in her back, and she took prednisone, and it killed both of her hips. She had to get hip replacements. Oh. So prednisone can kill the little artery that goes to the hips, and that happened to her. It occluded it. So I don't like that medicine for people. It's very, very powerful anti-inflammatory, and I wouldn't take it. I just took it for 7 days, and I stopped. Well, did it fix your elbow?
No.
No. Yeah.
No.
So I think what I do can fix it. I'm pretty certain of it. I can't promise anybody anything, but I treat elbows all the time. I treat knees. I treat toes, hands, fingers, shoulders, necks, backs, you name it. Muscle tears, ligament problems, hamstring attachments to the butt. I treat those with tears all the time. And it seems like people get better most of the time. If they listen to their doctor, that's me, they usually get better. If they don't listen to me, they're not going to get better, And the big listening is give it a chance to heal. Don't go right back and do your sport again or whatever it is you're doing that caused it.
That's right. And then your phone number at the office again is what?
The phone number to the office is 800-300-9300. And if you want to call the studio right now, please call me live, like Bill just did, at 866-870-5752. Bill, thank you so much. I appreciate your call, and I think you're going to heal.
Thank you. Thank you, Doctor.
God bless you. Yeah, thank you so much
Thanks
for
for your
calling.
call, Bill. And what's our phone number?
866-870-5752. And if you don't call, guess what's going to happen to poor Nita Valens?
Well, I do think we should talk for a minute about the website.
Okay. She'll do anything not to have to answer a joke.
Yeah, I'll get up and dance on the table.
Well, why don't you get in front of the video camera right now and do it?
I have to think about that for a while, okay? So the website is www.jointrehab.com, and it's fabulous because you can see Dr. Darrow actually performing the treatments on videos, and you can email him off of every page on the site.
Yes. Well, let me go to another question, Nita.
Do it.
Let's see. This is a very spiritual question.
Oh, boy,
Are
our
you ready?
favorite.
And you should be able to answer this.
Okay,
Okay, you guys know who the Dalai Lama is?
of course.
Great spiritual leader. But guess what? He loves to go to Vegas. Why does the Dalai Lama go to Vegas?
Did you just sneak in a little question here for me?
Yes, Nita, go for it.
That's hilarious. The Dalai Lama goes to Vegas to
Because he
gamble.
you're close. Because he loves Tibet.
Oh, that's a really good one.
Isn't that a great one?
That is a great one.
Okay. Now, this one I've done, I think, a couple of years ago, but it's so good I want to do it again. And Nita, because I did it before, I know you have a photographic memory.
Oh, yeah.
So this old Texas cowboy goes into a bar, never been there before. And he goes up to the bartender and he goes, "Hey, bartender, give me two cold ones." And the bartender gives him 2 cold beers, but he says, why don't you just take one of them now and I'll give you a fresh cold one later after you drink it. And the Texas cowboy goes, "No, one's for me and one's for my brother." And then he goes in the corner by himself. All the other cowboys are looking at him. And he drinks a sip from one cup and a sip from the other glass. And he does that and finishes them both. He comes in every frickin' night and does that. He goes to the bartender, "Give me 2 cold ones." Goes in the corner, drinks a sip from one from the other. He says, "One's for me, one's for my brother." One night he comes in and he just asks for 1 beer. Goes in the corner, starts to drink. Everybody is watching him. They feel terrible. And the bartender comes over and he goes, "I'm so sorry about your brother. I'm so sorry." And the cowboy goes, "What are you sorry about? I just stopped drinking."
That's hilarious.
I thought you might like that, Nita. It's too bad you didn't get it.
No, I got it, but I didn't remember it. I did not remember it.
All right. Well, let's go to a question here.
Let's do that.
Let's see what I can find here. Here we go. This one says meniscus injury. Let me see what the person says. I need to make an appointment. I have knee problem. I got my MRI and my meniscus is damaged. I want to try stem cells instead of knee surgery. Well, God bless you, man. I think you're making the right choice. So people who listen to me regularly know that I had bilateral meniscal tears. That means both knees with meniscal tears. And it happened. I mean, I don't know why it happened, but stick with us and I'll go back to this. I'm going to give out the phone number. We're going to break, 866-870-5752. I want to talk to you. And then to get to the office, it's 800-300-9300. And the website, www.jointrehab.com.
And we'll be right back.
Yay!
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.